Hi, this is Kirk, the Bariatric Carnivore. Well, let's talk about healthy adherers and why they're so important to understanding some of the pharmaceutical claims that you often see in some of our major medical journals and hence in news media and what your doctor's opinions are. And I saw this in an article, it was a bit in a really good online newsletter. It's free from Dr. Eads. It's called The Arrow. And I really recommend that you get look that up, grab a copy of it. It comes out every Thursday evening, and it is always chock full of really great information. And what he described was this peculiar effect in studies when there's this particular case was with elderly people and statin medications. And the way the pharmaceutical company sold it to the public was, hey, we gave these statins to these group of older people, and the people that got the statins, there's a group of them that wouldn't take their drugs or didn't take them or took them haphazardly, and they died at a much higher rate than those people who took their medication religiously. So ipso facto, abracadabra, whammo, you need to take the statin and you won't die. Okay? And that is true, but it doesn't tell you the entire story. Because when you look at the people that religiously took their sugar pill, their mortality rate was the same as those people that took the statins. And there was virtually no differences between the two groups. And this is an interesting thing, that people that adhere to medical instruction have a tendency to be healthier. So they're following instructions. Details matter. And if it really doesn't make any difference which group it is, when you take a look at those two different groups, you're going to see that those that are healthy adherers are kind of like a healthy user bias. They are going to be more health conscious. They probably watch what they eat. They probably actually exercise. They probably eat after their meals and stuff like that. They probably don't drink very much, and they probably don't smoke because they are health conscious. It's kind of like the healthy user bias that we find in epidemiological studies when they try to tell you that meat eaters are going to die. They're going to get diabetes. They're going to have all these health consequences. And you kind of look at it going, wait a second, what's the mechanism of action? Well, there isn't one. But what they're going to try to do is claim that in a large population, people that eat meat are going to die at a much greater rate. Well, you have to kind of look at it going, is that true? Well, who are the people that eat meat? And by the way, when they say eat meat, they have a tendency to lump processed, non-processed meat together as a category. Now, the people that eat pepperoni on pizza are different from people that eat steaks. They are two different groups of people, yet they are lumped together. And when you lump them together, you got kind of a problem. Frankly, if you go to McDonald's and you grab a quarter pounder and you only eat the patty, that's very different than eating the bun and the fries and drinking the Coke. But unfortunately, with an epidemiological study, you're lumped in as a meat eater, even though you're eating all this other crap. You're eating a lot of processed fried food plus a sugary soft drink, but you're classified as a meat eater. I don't think that's true. I think that's not real good science, but that's what happens with it. And the same thing happens with pharmaceutical trials and how things are sold in articles, and they will tout the part that sells the product. I mean, unfortunately, our major medical journals, British Medical Journal, Lancet, the British Medical Journal, the New England Journal of Medicine, all their former editors have written editorials and letters saying, you know what, we're just shills for Big Pharma. What you may not realize is the big money in, if you own the New England Journal of Medicine, you do not make money on subscriptions or ads. Where you make money are reprints. And if you run an article that Big Pharma likes, they're going to buy lots of reprints at, $100 or so a copy so that they can get them in the hands of all the doctors. They don't photocopy those things. They buy reprints because that's a payoff to the big journals. And all these editors, like the former editor of the New England Journal of Medicine, said that nearly half the stuff that they're publishing is just not true. It is just basically a buy-off from Big Pharma, which is unfortunate for your health and the health of other people. And unfortunately for your doctor, who may or may not believe the big pharmaceutical, the big publications. I mean, who are you supposed to believe at the end of the day? What's our source of truth? And it used to be that, when the New England Journal of Medicine or the British Medical Journal published something, everybody took that as truth. But the system has been corrupted so badly over time, primarily from the money from Big Pharma, that it has ruined the system. There's not much of a source of truth left. And that's beyond unfortunate. That's just indicative of how bad our horrible, dysfunctional medical system is. You can't be 100% sure what is being published in a major and prestigious medical journal is actually true, or is it just a sales pitch from a big pharmaceutical company that spent a lot of money on a trial and they're trying to put the best spin on things. You'd think, well, maybe, it's a peer-reviewed journal, and therefore, by golly, we can believe it because somebody peer-reviewed it. Well, let me tell you how peer review works. And if you think the people that are reviewing those papers are paid, you'd be wrong. They're often asked, oh, you're a prestigious person, can you review this article? And they're doing it without compensation, so they're not going to be putting a huge amount of time in it. They will look for maybe glaring errors to see if it makes kind of sense and some mechanistic. But for the most part, they're not doing in-depth research, and they don't have access to the raw data because that is protected by trade agreements. So they can't dig into it. They don't know the science all that well. They're just kind of glossing over it and saying, okay, it kind of makes sense. And it was a big enough trial, so therefore it's okay. In other words, the peer review system really doesn't work that well to protect you either. So the journals are being used as shills to sell more pharmaceuticals because they make money off the big pharmaceuticals. There's not that peer review indication, frankly, is not that great a test to see if it is really doing what they say it is doing. Unfortunately, we're still kind of in the wild, wild west. This isn't like the old days when things were snake oil, but they're pretty close. Unfortunately, there's not all that much deep stuff until things get into the marketplace. And frankly, you would think maybe our federal government would be looking over their shoulders, but they're not. They're just kind of rubber stamps because most of their budget is paid for by Big Pharma. And they get more money in their bureaucracy when they approve medications in terms of fees and other stuff. So it's not a system that is looking after you. It is looking after a lot of other interests, but not you. It isn't until things get into the marketplace and what we call the stage 4 trial, where things are going out to millions of people, get injected in millions of people, that we really find out the real side effects. And when things get bad enough, then somebody starts suing, and then things get pulled off the market. Until then, you're on your own, and you're injecting yourself, and you're putting in medications that frankly aren't as well tested as you might think, We're doing procedures that may not be as well studied as you might think, because the studies in the journals are flat out corrupted. And this process is just not looking after your health. So what's the answer? Frankly, your best shot is to be as healthy as you possibly can so that you avoid the whole damn thing. Probably your best bet in staying healthy is just trying to be so healthy that you don't need them. Look, I've kind of proven in my own life, our system, in the last few weeks, I needed them because of an emergency. I mean, I had a blood clot in the lungs. That is an emergency. It kills a third of the people that it affects. I get it. I needed their help. It was an expensive proposition, but it was needed at that particular time. And they did a great job on it. But frankly, the follow-up care, which I'll talk more about later, was horrible. There's nothing about how to get you healthy and how to avoid this type of thing in the future. And that's really unfortunate, but I kind of knew that going into it too. So this is Kirk, the Bariatric Carnivore. Look, realize that Big Pharma is there to sell their product more than anything else. That's what they do. They have an obligation to their people that own the stock in their company to make as much money as possible. They are going to sell their product the best way they possibly can. And it's not that they're out to deliberately harm you, but they're not working in your best interest either. Neither the big journals, neither is the government. Frankly, the only one that can look after you is you. So that's the sad state of medicine. I wish I could give you better news, but it just means that we've got to work harder as people to stay out of the system, to be as healthy as possible so you don't need it. This is Kirk, the Bariatric Carnivore. I try to put out a couple of messages each week. If you like this message, please hit the like and subscribe. Join this tribe. Try to get other people to do it, because the more people we can get this message to, the more people that are armed enough to be able to ask serious questions and to take control of their health. I will talk to you again soon.